Occipitocervical fusion with Steinmann pin and contoured rod. This is a case of a young girl with spondyloepiphyseal dysplasia. Markedly dysmorphic bones and connective tissues make this a very treacherous case. One can see that there is gross instability at the occipitocervical junction with evidence of cord signal change. This girl actually fell off a jungle gym and became quadriparetic temporarily, ultimately regaining function. One can see the significant narrowing of the spinal canal as well as the myelomalacia. This child needs an occipitocervical fixation. However, fixing the spine to the skull in this case requires a technique not commonly employed. Typical screw rod and plate fixation is not possible in a child with spondyloepiphyseal dysplasia. What we need to do is to gain as many fixation points as possible. This is done with a threaded Steinmann pin. At this point, what we're doing is placing in an endotracheal tube stylet bent into the patient's anatomical configuration. We then make numerous laminotomies up and down the spine for the passage of sublaminar cables. These have a very high pull-out strength and are also perfect in the setting of a patient in whom we cannot use lateral mass screws. Once all the wires are passed, we ready them and bend the Steinmann pin, which is contoured and knurled, into the patient's configuration. Once we have a good fit for this, we're able to place the wires through and ultimately tighten them one by one. These should be done in segmental fashion and contralateral. So we'll start by tightening the bottom right wire and then the upper left wire, the bottom left wire and the upper right wire, and do this sequentially, sometimes with temporary fixation and ultimately with permanent fixation and crimping of the wire until the Steinmann pin is firmly affixed at every contact point. Once this has been done, immediate stability of the spine is gained and irrigation and decortication is undertaken. A structural graft is used, and that is wired into place, again compressing that graft between the upper cervical spine and the occiput. Additional bone matrix is placed and the wound is enclosed in standard fashion. Postoperatively, we see a beautiful decompression of the occipitocervical junction with placement of the threaded Steinmann pin. Ultimately, this child recovered neurologic function and has been doing quite well.